a little bit about who family caregivers are and what caregiving looks like, and then hear from our three presenters, Lisa from the Respite Care Association of Wisconsin, Elena from the Senior Resource Association, and Bashir from Melanin Minded Transportation, and then hope to have some time for some questions. So I want to start by talking about who family caregivers are and what family caregiving looks like. In my previous job, I worked as a caregiver support professional in Wisconsin for over 10 years. So talking about family caregivers is a passion of mine, and I'm eager to share how transportation and caregiver support aligns. The National Alliance for Caregiving and AARP do a nationwide survey about every 5 years to get a picture of what family caregiving looks like in the US. Their last survey was done in 2020, and from their findings, we learned that there are 53 million family caregivers in the US, which is about 21% of the total population. So who are all these caregivers, and what does caregiving look like? Caregivers are all ages, and there are many types of caregiving situations. They might be a middle-aged daughter or son helping their parents as they age and need additional support. They might be an older man or woman caring for a spouse who has dementia or other condition. They might be a brother or sister assisting their sibling who has a disability, or a parent caring for a young or grown child with a disability. A caregiver might be a grandmother who is raising their grandchild in the absence of the parent. Or it might be a friend or a neighbor who's stepping in to help after a surgery or illness. Caregivers are family members or friends assisting people that they care about, usually without any compensation, either out of love or a sense of duty, or a combination of both. But what they all have in common is that they're helping someone else with activities and tasks to enable them to stay engaged in the community as much as they wish and to live as independently as possible. What exactly do caregivers do? Here are some few examples of what caregivers do. Caregivers might be living with the person they're caring for and providing hands-on care, such as helping them with dressing, grooming, and bathing, or providing supervision to make sure the person is safe in their home. Or caregiving may be someone from a different household stopping in regularly to help someone with house cleaning, home maintenance, preparing meals, helping with paperwork, laundry, those types of things. But caregivers also provide transportation for medical or other appointments, shopping, errands, and social activities. And this is why we're here and what we're here to talk about today. So some caregiving and transportation stats. From that same survey, we find that caregivers provide a lot of transportation. 80% of caregivers provide transportation, and that is the most common IADL, independent activity of daily living, that they support. But we also find from the same survey that caregivers don't typically utilize community transportation program. Only 25% said that they have used a transportation service to help in their caregiving. So I see this as a great opportunity for transportation providers to step in and help. Why don't caregivers use transportation services? A few ideas. Caregivers don't always know what options are available. They may have never used public transportation before. They've always driven where they want to go, and so they just don't think about alternatives. And you're going to hear from Lisa Schneider about a unique program that connects caregivers with transportation as a form of respite. And she's also going to provide some tips on how to better coordinate transportation and caregiver support. Another reason caregivers may not use transportation is because they don't know about or understand the support services that are available. And you're going to hear about a travel training program from the Senior Resource Association that teaches people with disabilities how to utilize public transportation, which provides a benefit for the person as well as their caregiver. And another reason caregivers may not use transportation is that they're very concerned about the safety of their loved one, and they tend to be a little reluctant to let strangers in and provide care. And Bashir Easter is going to be sharing about a very unique dementia-capable transportation program that has a strong focus on safety and building trust with the caregivers of people with dementia. So without further delay, I'm going to pass this on to Lisa Schneider from the Respite Care Association of Wisconsin. And now I'm going to let the speakers introduce themselves. So go ahead, Lisa.
Well, thanks, Jane, and nice to see you again. We used to work together so much, and so I've only seen you sparingly. Hi, I'm Lisa Schneider, the Executive Director of Respite Care Association of Wisconsin. So you're probably wondering, what the heck is she doing here to talk to me about transportation? But there is a connection, and as a family caregiver myself, transportation has been very key in my life. Next slide. Oh, by the way, I am a middle-aged, can I say middle-aged, even though I might be elderly? I'm not sure. White female with blonde hair wearing a black sweater over a white blouse. So first off, I want to tell you a little bit about our organization. We are a nonprofit organization where we're contracted with the state of Wisconsin to coordinate respite care services across local and state levels, as well as across the lifespan. We're mainly funded with state general purpose revenue, and we also receive federal grants, either directly or by working through the state of Wisconsin. And so we've really grown programs because of these funding resources, and we're very happy about that. So lifespan means that we support people of all ages. So as Jane was saying, that we support moms and dads that are caring for their children, who maybe need to get to different appointments or school or daycare, to persons caring for their spouse, caring for their wife who has dementia, that has some medical appointments. So it's the whole gamut is what lifespan means. So for our programs, we work really hard to address the gaps in existing systems and programs, and we want to capture those that fall through the cracks and support them. So basically, in a nutshell, we serve people who cannot be served by any other program. So as a result of that, while we've got a number of programs, we created our supportive respite grant program as an option to help those, especially with transportation. Next slide. So as I mentioned lifespan earlier, Respite Care Association of Wisconsin, each state is set up differently. As you can see the map right there, there were 38 states that became lifespan respite grantees. About 29 of them are current respite grantees. And so we work really hard to collaborate with other partners throughout the state. We collaborate with the state of Wisconsin. And so we create programs again that for those that cannot be served by other programs. So depending on the state where you're from, I've listed a website that you guys can copy and paste. And if you get the presentation, there should be a live link in there. And you can go and if your state has a little orange dot on it, you can click on that and it'll give you the contact information for both like the respite coalition for their state. They might list it as something else, but it's an equivalent to who we are. And also the state of Wisconsin, the state connection for the lifespan respite grants for their state. So it'll give you both of that information. Next slide. So our supplemental respite grant program was created basically as a result of our caregiver respite grant program, which provides direct support services, direct respite care. But we were getting a lot of calls in regards to wanting funding to help support with house cleaning, meal prep, lawn care, snow removal, and transportation. And so we decided to create a supplemental respite grant program to help address those needs. So right now, we offer applicants up to $250 for supplemental respite services. You know, again, they can use it for many different types of services that are non-direct respite care. And right now, they can apply up to every 90 days for this funding. Depending on our funding, this has been as low as every 30 days. So it always fluctuates for us, but it's pretty reasonable to help family caregivers get through to access these dollars and to use it to meet their needs. Next slide. So with our program, we always ask the applicants, how are they going to use their funds? Like, what are they wanting them for? And so you can see the percentages of people that percentage of responses for the particular areas or needs that they're wanting our SRGP funds for. And transportation is our number 5, the top 5th reason why people are applying to us for SRGP funds. Next slide. So we also asked them, okay, so you're asking for transportation. So what specifically are you needing in regards to transportation reasons? And the most common use of the SRGP funds for transportation were medical appointments. And I saw that was like one of the top ones on Jane's slides as well. That was definitely the top one. Some of it was for social activities and outings, occupational and physical therapy appointments, day programming and care, and for errands. Now, just to be clear, this is for the transportation of the care recipient, which is what in turn provides respite for the family caregiver. So, next slide, I'll continue my story. So as a mom of a 34-year-old daughter with intellectual and developmental disabilities who still lives at home, she is nonverbal, and I can't tell you how important transportation was for me in regards to maintaining employment and supporting my family. I needed transportation to get her to school. And then after school, I had transportation take her from school to her daycare, because school gets out at 2:30. My work didn't. And so then I would go, then she would get after school, get transported to her daycare, where then I was able to go pick her up after work. And that really filled the gaps. One, it was allowing me to breathe because I knew she was being taken care of, and in a very smooth manner. Everything was covered, all bases. And I didn't have to worry about getting out of work early and risking my employment because we had an arrangement. So I will say, though, that achieving true respite for the family caregiver when transportation occurs is there's got to be a positive experience. So I've had times where, my daughter, being nonverbal, is trying to be expressive and maybe isn't being understood. And you probably all know about behaviors, and she would have some behaviors, and we lost transportation as a result. But that was because there was a lack of communication, and we'll talk about that in a little bit. So as I talked about before, some people with disabilities qualify for long-term care waiver programs, as my daughter does. So that helps pay for the transportation, but it also provides me with someone who is aware of the transportation sources that are out there and can help me connect with them. But many families do not qualify for these other programs. So how is it that they find out about the transportation services you offer? It's also very costly in some cases. The ARP research indicates that family caregivers spend almost $7,242 out of their pocket every year for caregiving expenses. And so that is really where our program can come on in and help them with some costs and help spare that high level cost that they're incurring each year. Next slide. So again, as I talked about earlier, the ways to better serve family caregivers is about having it be a positive experience, both for the rider and for the family caregiver, but also the driver. So having them understand the needs of people with disabilities, including folks with dementia, and depending on who you're going to maybe target, or you're not going to target certain populations. But to get to understand some interventions or de-escalation or communication techniques really helps improve the experience and pretty much ensures a subsequent ridership, where maybe if it's not a good experience, it's going to end with that one ride and be done. You can also offer mobility training to let family caregivers understand how to use the system. How much advance notice do you use and do you need? And to just, again, communicate on the mobility training. And to talk about provide experienced riders who can travel with the person who's going to be the rider themselves for the first few trips. So that kind of helps redirect, because it's a new experience for the rider, and they can help maybe intervene between the driver and the rider, but also just to help be there to just make sure that it's a smooth experience for the first couple times. And to create options to meet the needs of family caregivers, care recipients, respite care workers, and volunteers. Again, getting to know some communication, and I'll talk about that in the next slide, so I don't want to get ahead of myself here. And I know this is probably odd from your perspective, but to include transportation in the respite planning process, if you kind of describe it that it can be a form of respite to family caregivers, that is really a huge selling point. And that would tell me that you're in tune with what I need as a family caregiver to a person with a disability. So that would be, to me, a huge selling point. Next slide. Excuse me. So tips for connecting with family caregivers. Here's a couple, but the first part is just caregivers may be reluctant and need encouragement to accept help. One of our biggest hurdles is just having family caregivers recognize that they're family caregivers, and they just assume that they're not, when in most cases they are. But it's really important between either the provider, the driver, and the family caregiver and the care recipient, or the recipient, to foster really good communication. The more that you can set up expectations up front, the better things can be. So it's unfair to have a driver come pick up my daughter not knowing she's nonverbal and may exhibit behaviors if the driver uses a loud, gruff voice. There's little things in there that can that are super easy to make it a positive experience. I would also be respectful of family caregivers. They're already under a lot of stress, and the last thing they want is one more stressor to add on to the pile. And to practice empathy as well. So, kind of say, we got this, we got you, we're going to take good care of your loved one. And also to just be a partner in the care. So those are some great selling points, again, to family caregivers, to put them at ease and partake in your transportation offerings. Next slide. So here are some considerations when promoting transportation services. So make your transportation services known. Again, as I talked about earlier, for family caregivers who are not connected to any programs and are relying on themselves or their family, aren't getting any referrals or recommendations to transportation providers. And so as much as we talked earlier about transportation to medical services and to therapy being the primary top reasons that family caregivers are requesting a transportation, maybe those are some of the places that you promote your services. Partner with some of these medical locations and have your business card in the lobby so family caregivers can pick that up. Also, it's important to promote your accessibility transportation options. So not everyone, needs wheelchair accessibility, but they do need accommodations in regards to nonverbal or de-escalation. And so that promoting that trained drivers is another form of accessible transportation, in my opinion. But there is still the traditional accessible transportation options that need to be promoted. And to also tailor communication and services to address the unique needs and challenges faced by family caregivers. So if you've got persons that are trained in de-escalating behaviors, in a myriad of other things, the more that you can address common challenges faced by family caregivers, the better that experience is going to be. And then to also emphasize the experience of your drivers. So do you conduct background checks? What kind of training do you offer? Are they compassionate, on time? Safe, and also safety is of the utmost concern to caregivers, and on both parts, for the driver and for the person who is being chauffeured around. So safety is very key. Next slide. So here are some strategies and resources for connecting with family caregivers. Again, to partner with a lot of different agencies that have a wide net to cast, or work with other agencies and have a huge network that they can share information on your transportation services. So you can see here, there's a list of a number of agencies and organizations and for you to contact with and say, hey, you know, we really want to hone in on this particular service. Do you have any ideas of who we could partner with to really make this a solid program that people can rely on, be aware of, and use regularly? So in regards to the training that we talked about earlier about promoting that your drivers have received training, the NADTC offers the several trainings that are free that looked really well done. So you can go on their website and look in the area of Access Matters. If you get this presentation, that's a live link. Otherwise, I'm sure Jane can direct you where to go. But there's a lot of great topics for trainers to be trained on. And I don't know, it's free. And I think it's just another big selling point to connect with family caregivers. So next slide. That's it. I want to thank you all so much for the opportunity to talk with all of you. And I think I can stay on, Jane, because I was mixed up with my meetings. So if there are any questions at the end, I'd be happy to answer them. But also, I just want to hear what you guys have to say as well. So thank you.
Excellent. Jeremy, are there any questions for Lisa right now, or shall we move on?
Yes, we do have 3 questions, which hopefully we can get through pretty quickly. To clarify, does caregivers include providers that are funded by the state, including home or community-based services through Medicaid waivers? Additionally, is this for populations with intellectual developmental disabilities and individuals receiving long-term care or services?
Well, at least our program, the SRGP that we talked about, does not serve caregivers that are receiving long-term care waiver funding, or there's the NFCSP, which is the National Family Caregiver Support Program. So we usually serve those who are not funded with long-term care waivers, and because the waivers pay for all of that services, and there's usually a caseworker that can connect them with transportation. This is really meant for family caregivers still serving as the primary caregiver of their loved one, not any ones that are in an adult family home, but living at home and being transported to an adult day center and coming back, yes, especially if they're not able to be served by other programs.
Okay. Thank you. The next question is, can family caregivers apply for the supportive respite gap funding in addition to 3E gap or respite funding from their local AAA?
I might ask Jane to help me with that because I'm somewhat unfamiliar with some of the AAA programs by that number.
I think that, it really depends on your state. And I think that Lisa has a really unique program in Wisconsin using the lifespan respite funds in coordination with the 3E funding. But the map that she shared will indicate if you have lifespan respite in your state, and you can connect and find out. I think that answers your question. And I think we should maybe hold the rest of the questions, especially if you can stay on, Lisa, so that we can hear the other presentations.
Absolutely.
So sorry. And if we don't get to everyone's question live, we will absolutely answer them through email afterwards. So we're gonna thank you so much, Lisa. That was really informative and very interesting. We're gonna move on to Elena Rule, and she is going to talk from, I'm just gonna let you introduce yourself, Elena.
Okay, let me unmute myself. Can you hear me?
Yes.
Okay. I'm Alina Rule. I am an administrative assistant to Christopher Stevenson, who is the director of Indian River Transit. I'm currently in Vero Beach. I'm an older female with gray hair. So yes, I am a pensioner. Thank you. I'm here to talk about our Treasure Coast Developmental Mobility Advantage Ride program. As you can see on slide 2 here, the purpose of the Treasure Coast Developmental Mobility Advantage Ride, besides being a tongue twister, is a state and locally funded program designed to meet the needs of those who have no other means of transportation or cannot obtain transportation due to a developmental disability. There is an eligibility process that the clients will need to go through to see if they meet and fall within that. Because we are also with Go Line, we provide free transportation throughout Indian River County with bus system, which is a free ride system. So if you're unable to get to the bus, or it's not safe for you to ride the public bus because of a developmental disability, then the community coach, the Advantage Rides program, is set up for that particular need in the community. Okay, slide 3 is our target market, as I said, is the Agency for Persons with Disabilities, also known as APD, and we serve more than 50,000 individuals with intellectual or developmental disabilities in Florida. We don't serve them, but that is how many are in Florida. And of course, that number is going up. Number 4, the history is the Treasure Coast Developmental Advantage Ride program began as a partnership in 2020 between Senior Resource Association, who is the CTC in Indian River, and Martin counties. We are the Community Transportation Coordinator. That's what CTC. The Florida Developmental Disabilities Council, the Florida Commission for Transportation Disadvantaged, and the St. Lucie County Transit, and we are the CTC in St. Lucie County. We have the pilot program was the Florida Developmental Disabilities. That was the pilot program. St. Lucie County Transit and SRA have combined so that there's just one phone number for people to call to arrange for transportation for their people, and for individuals to arrange for transportation also for themselves. So we're trying to make it simpler for everyone. If you're in St. Lucie County, if you're in Indian River County, one phone number to call to get assistance. All right, and then slide 5. There's Advantage Ride history, which we started in June 2020 with this program. We were using 5310 funds. They assisted with expenses in 2022 to 2023. Unfortunately, we no longer receive funding for that. They have a limited period of time to assist, and we've used those funds up. So after June 2025, we're not certain the future of the Advantage Ride program, but we are actively looking toward finding and securing sustainable funding for this. There is a need, and we are actively working to pursue that. I don't know if you want me to read this slide, but it's really just a history. We can go to 6 if we wanted. Our coverage area is a 4-county area. We cover Indian River, St. Lucie, Okeechobee, and Martin counties. And on the screen there's our 4 little counties all highlighted, and is considered the Treasure Coast. Slide 7. As Lisa did mention, that is needed. We do have required training for our staff, for our call agents, and for our drivers. It involves anyone involved in the Treasure Coast Developmental Advantage Ride program. It includes the Agency for Persons with Disabilities, has the Introduction to Disabilities Guide. There's a Department of Health and Human Resources, which is Vulnerable Adult Abuse, Neglect, and Exploitation. That would cover training for independent providers, Child and Adult Protective Service Acts, mandatory reporters, reasonable cause, how to report penalties for violating laws, that sort of thing. And then we would have the 5 tips for working with people with disabilities. And then, of course, Rutgers Disabilities Training Series, and with the overview of disabilities and understanding and managing behavior, because everybody has good days and bad days. And we want everyone to be aware of common developmental disabilities, including learning disabilities, attention deficit disorder, autism spectrum disorder, intellectual disabilities, sensory processing disorder, and Tourette syndrome. And we do have a couple of riders with Tourette's, so we have to make sure everybody is on the same page and nobody panics. when the individual gets a little excited. How to de-escalate the situation, bring it down, and keep things moving smoothly and get everybody to their trip, to their destination safely. Okay, slide 8. Our objective is to increase transportation. We want to increase a developmentally disabled person's access to and from job training, employment, healthcare, and other life-sustaining services and activities that are needed to improve a person's social determinants of health. This year, well, in 2023, 2024, we have actually are also working with an app because a lot of people like smartphones. So we have an app that we are working with people, training on how to use the app so that they can, caregivers and the individuals can get rides 24/7. So if they find out on Sunday, oh, I want to go here on Wednesday, they can just pull up that app and book it. They don't have to wait for us to open to get that trip booked. So it doesn't slow anybody down. It keeps everybody moving. And so that is something that we've done to help initiate with the community and to have their access to to be able to book trips. Slide 9 is enhance regional connectivity. We do want to have it across county mobility, serving 4 counties, as I mentioned, Indian River, Martin, St. Lucie, and Okeechobee. A lot of our clients will live in Indian River, but they're doctors in Martin County or St. Lucie County. So we want to be able to make sure they can get to that provider without having to change doctors just because they've moved to a different county or their doctor has moved to a different county. It's something that we're working with, and we have that open communication with the providers. Slide 10 is we provide specialized customer service. Our drivers, as I mentioned previously, are specially trained to understand the sensitive challenges associated with persons with intellectual or developmental disabilities, enhancing safety before, during, and after a trip. Like I say, and a lot of times, a lot of our drivers are transporting the same clients because they're either always going to their job every day, or they're going to their medical appointments pretty schedulely, or they're going to school, Indian River State College. So because these individuals are doing something consistency, they are building a relationship with their drivers, and they are building a relationship with other passengers in the vehicle if they're sharing a ride. We are the lead agency for transportation assistance also during an emergency. So we have to be in contact with the caregivers to assist in transport of individuals to a safe and stress-free environment. For our caregivers specifically, when the eligibility form is set up for the individuals, when they go through that application process, they have to say if they want a caregiver to ride with them. People just can't show up and say, I'm with them today. It has to be set up. They have to be set up in the program to be able to ride eligibility wise. And that can be a PCA. It can be whoever is set up as their caregiver will be able to ride fee-free with their person should they want to. Slide 11. We do provide cost-effective transportation. As it says, eligible riders will not be assessed any fees for the service and are able to travel all throughout the Treasure Coast, which is those 4 counties. As Lisa mentioned in her presentation, that is what's very important, is that transportation to get to where you're going. And I have to say also that our caregivers have repeated that not having to be with the individual the entire trip process is a form of respite for them. It's okay, I can take a break. I can sit on the couch. I can decompress a little bit because I don't have to worry Tiffany has gone off or Sammy has gone off. They're going to college, they're going to work. Maybe it's their spouse, and they can now use their car to do other errands, maybe run the other kids to a soccer game. It just helps. And personally, I think it provides independence for that individual who might always be stuck with a caregiver. And now's their chance to go off a little bit in the world on their own and have their own experience, as it were, something to share when they get home as well. Slide 12 is our performance matrix for those of interested. Those are our daily trips, and you can see that there is a 245% increase in our ridership because the need is growing. More people are coming in to Florida, and it just goes up and up, which is why we are still seeking that funding, to find that sustainable funding. The riders are not going to go away. We need to find a way to keep people moving and to keep that independence. Slide 13. Yeah, those are trips provided. So you can see that our trips provided, we've between October 1st, 2020 and May 31st, 2024, there have been 166,000 trips, higher than that provided, with 3,888 unduplicated clients. So it's it's a lot, and we can do it, I think. Slide 14. Here's our trips provided per county since 2020. You can see St. Lucie has the majority of people. It is a very large little community, but it's also rural. Okeechobee is also rural, but not so many. It's less people, bigger farms. And Indian River and Martin counties are about tied. They're generally your urban communities. We're not as huge as some cities, but we're moving up there. But we're keeping everybody connected, everybody moving. Slide 15, our trip destinations. And as you can see, in our case, our job training and education is our highest amount for these disadvantaged. It's the medical appointments, worship, well, family and friends, grocery shopping, that is there. But the employment, these are individuals who are going to a job, they are going to school, they are going to their job training, and they need to be there at certain times. Off they go, they do their employment, we pick them up, we take them to work, we pick them up, and then we take them to their job training, take them to this, like I say, Indian River State College or other schools. Some are even high schools. So it's what it is. It is not, in our case, the medical appointments as much as employment, job training, education, which is important for your individuals and their giving back to the community and the community giving back to them. Slide 16, performance matrix. Cross-county trips, as you can see, 50% of all trips begin and or end in St. Lucie County. And 43% of those are all across county lines. So it is a lot, like I was saying earlier, doctor's appointments, jobs, you live in one county, you work in another. That's our cross-county trips. Slide 17, our average trip is about 2.2 minutes, and the average distance is about 9.8 miles. Try to keep them as quick and short as possible, because somebody who has a disability, or even the elderly, you don't want to sit for 2 hours on a bus. You got things to do, and it's an enclosed space. So we want to get through there as quick as you can. Yes. And 98% are ambulatory, 90% are for wheelchair trips. So, you know, and this is just some customer feedback. There's quotes from people. They're very thankful for their rides, don't know what I would do without it. And they've used door-to-door programs in the Treasure Coast. Advantage Ride is by far the best. That is something I didn't say. We do go door to door. We don't go curb to curb. We're not Uber. We're going to go to your door. We're going to assist you into the vehicle. We're going to assist you from the vehicle to your door. We're not just going to drop you off and say bye. Good luck out there. We're going to make sure you are safe into the door and out to the door. They love the program, and without this program, some people would have a hard time getting to work every night. We have because of the requests, we have actually upped our hours. We are now open. We are running Go Line and everything until 9 o'clock, and we are Saturday 7 to 7. So we've increased that hour time so people can go to work, and then they can also go to the grocery store if they need to. So, and not just coming home at 5 and we're done. No, I can come home at 5, or I can go to the grocery store, or I can go visit somebody and then come home a little later. We've got a little longer time. So our goal line runs longer, and you're fine. Our Advantage ride runs longer as well. You're good. All right. And thank you. And any questions,
Yeah.
we'll wait to the end.
I think we will. I think I'm going to have Dr. Easter go next to make sure he gets his presentation in. And I'm going to ask people to keep putting your questions in Q&A, and Jeremy's going to help me with those after Dr. Bashir Easter. So go ahead with your presentation.
Right. Good afternoon, everybody. My name is Dr. Bashir Easter. I'm excited to share the services that we're providing. I'll give a little background on how I got started with using transportation. Originally, I was an elder abuse investigator for Milwaukee County for 4 years, and then I became the first dementia care specialist for Milwaukee County before all 72 counties were have your dementia care specialists now. In that process, I started the concept of what we say the Navigator Transportation Service. And so I then branched off by starting Melanin Minded LLC and Melanin Minded Foundation in order to move this forward because I started to find these gaps. Next slide. One of the things that we talk about are individuals with Alzheimer's disease and related dementias, and knowing that African Americans and Latinos are the hardest hit, African Americans being 2 times higher to be impacted by this disease, and our Latin Americans 1.5 times higher. When we talk about resources and services, a lot of times they're at the bottom to know about some of these resources, including transportation. Well, Melanin Mind is to be the bridge for information services support for people of color. And our vision is to empower and equip people of color to have the ultimate quality of life. Next slide. Started this process because of my mother. My mother was diagnosed with just dementia at the age of 55. She was showing signs at 50, and we had no idea, no clue what it was because the doctor didn't share with us what dementia was, what type of dementia she had, and then the resources that were out there that could have helped us. One of the main things she wanted to do is still get out in the community. Issues with getting out in the community with this disease is your keys are taken away from you, and you're relying on family and friends to get you around. Next slide. So in that process, we started trying to look at this ride share service. Uber and Lyft came on the scene about 2014, 2015 in Milwaukee. Some of the things that they stated were being reluctant is to get in a car with a stranger, have them taking you around to some places, and then you have to pay them using an app type process. Well, now look at us. We're now using this across the world, right? So we use the same technology as Uber and Lyft. It's a ride share service that is app based that you're able to order a ride and get the individuals back into the community. When I say individuals back into community, we're talking about people with the early stages of Alzheimer's disease and related dementias, mild cognitive impairment, seniors, and people with limited disabilities. And why are we using that process? Well, we talked about these other forms of transportation using like Transit Plus. Some individuals are using taxis. Some of them were using other ways of getting people around. The issue was the individuals with this disease are having a difficult time in navigating. A lot of times it's more focused on the caregiver, making sure their loved one gets to where they need to be. Well, some of the issues with that as well is these individuals are now stating they just want to be able to go back places they stepped away from, barbershops, grocery stores, back to church. We're using a concept called dementia villages. It's really a more concentrated form in these certain underrepresented communities. And we talk about the dementia-friendly communities concept. In order to do that, we had to first do a pilot. We had to first say what this theory looked like in order to reach these individuals because we really didn't know their thoughts. So Milwaukee County Department of Health and Human Services gave us funding. That funding came from the ARPA dollars to be able to utilize this to be able to see if we can do this for the community. So what I did was I used the app called My Melanin Nav is the app that is used. And downloading that app, we had people to first try it because there were barriers that we noticed because we're talking about these senior populations and other individuals as well. And what was happening in that process was we didn't know if this was even something they could utilize, if technology would be an issue. So we did a pilot. We did a pilot for 3 to 4 months, and we had 6 focus groups that helped us to understand what this actually would look like in Milwaukee County. Well, how do we get the numbers? How do we even know that this was something that was a need? Well, the DMV stated that 300 individuals had their licenses revoked as well as their keys taken away because of mild cognitive impairment and other symptoms of ADRD. They stated that they could not, of course, try to tell anyone what they could utilize in regards to a program. So they basically said it's up to the families to try to figure out what to utilize. What we noticed right away is that some of these drivers that we have are the drivers that are needed, or drivers that were family members that had individuals that were care for them that they previously had ADRD or passed away, EMTs, firemen, and other people that were in the field that had the connection to the disease. So that was the heart people. Those are people that were going to be asked to do a little more than pull up. The other thing that we recognize is that these individuals needed training. So the drivers went through 72 hours worth of training to understand, and this general training that they went through was Dementia 101, music and memory. They went through Dementia Live, as well as defensive training and CPR. So they had to have the extensive background, just like anyone else, because they're using their vehicles. They would have to have, their insurance that we had to have covered. We had our insurance to cover them as well as they had to make sure the vehicles were up to par regarding them registration of the vehicles, tags, and all of their equipment had to work. So we had to utilize a system in regards to the $5 oil change organizations that allowed them to take their vehicles there for an inspection to have checked off. The other thing that we did is to make sure that there's a background check on every driver that had to go through, because as we were doing this pilot, Milwaukee County had to make sure that we had all our ducks in a row before we can have individuals transport anyone in the community. So during this pilot, we did 160 rides. The 160 rides that we did, where we had understanding that there was a stigma attached to it. No one wanted to say, hey, I have mild cognitive impairment or I have dementia. They didn't say that. What was happening is we used all the forms of people maybe using transportation and asked them to use this service. And if they could tell us their thoughts about this service, they would get a free meal for their information, and they did. So what we found out is the caregivers brought their loved ones, because the caregivers are doing the driving and they were realizing that, yes, I'm caring for my loved one who has it. We want to utilize this service. What we found out was astonishing, is that even though it was a theory, we started hearing from the individuals who were taking a ride. We didn't ask if they had any type of mild cognitive impairment or any type of ADRD. We asked for function level. So we tested them by function level using Teepa Snow's GEMS assessment. And we were assessing them to see their mobility. To see that, because a lot of times when you think about the disease, you think of the person in a later stage, not in the early stages of the disease where they can still function. And if they started to move in the later stages of using the Teepa Snow model, that's when we would suggest that they have somebody to take their ride. But the information that came back with that, next slide, information that we got back from the individuals is that they were able to go to places that they stepped away from. These places were, we talked about barbershops, grocery stores, we talked about back to church, but also people were talking about going to back to the lakefront, because they didn't have the transportation that they trusted to just take them to the lakefront. And if you all know about Milwaukee County, that area is open to everyone, and never knew that there was a transportation issue or barrier for these individuals. We found that some individuals even wanted to go as far as Holy Hill because they wanted to see the leaves change and things like that as well. So we were able to use that funding to get those people back into the community. They gave us a testimony on how this service helped them have a better quality of life. So when you use that, as now we are moving this, using this service to not only got the information for the caregiver, plus the individuals living with. The caregiver did the assessment to talk about what their feelings of understanding of caregiver burden, resources that they may not know of, and they were able to take a break because using this technology, they can actually see the ride as it went. We use this intergenerationally as well. I talked about the drivers were trained on music and memory. Why is that? Well, we understood that music is a science, and we understand it's not just a ride we want them to take, it's an experience. So those individuals actually sat in the front seat. They didn't sit in the back seat. They actually had a conversation with the driver as they went. But before they had the conversation with them, we created musical playlists for these individuals that that were created just specifically to them by having conversations to the families and the youth. The youth are considered invisible caregivers. So Jane talked about caregivers. The youth are also caregivers, but they're not recognized as such because they're just in the home bringing individuals something to eat or sitting with them. They're not saying that they are caregivers as well, in which they are. So we bring them together. We had a program called the Bridge U program. We trained them the same way. As they got trained, they helped create the musical playlist for the families. They use that and utilize that in their vehicle, and then they are able to have a peaceful ride as they go. After the pilot, we were able to understand that we wanted to expand this by using this as we build these dementia villages. And so what we've been doing is, as I stated, we have two arms. So we have the LLC and then we have the foundation. So the LLC is looked to be used as a way of working with our faith-based communities. Faith-based communities, we're building them to have these drivers come out of those locations. And as we build these drivers, what they're going to do is go through training, and then they'll be able to utilize this app, be just as another rideshare service. They will receive income, portion of their ride, but they go back into the foundation to help individuals they're living with not have to cover the full cost of their ride, or no cost at all. The other thing that we're utilizing the foundation is to get sponsorships, grants, and other ways to be able to utilize that to help these individuals. Or if some individuals have the means to pay, they will pay out of pocket, which we do have individuals right now that are paying out of pocket and are utilizing the service as well. Next slide. The other thing that we utilize in regards to this is a little different, is that some individuals are able to right out the gate take this service, and then, like I said, can utilize it right now. And they are taking it to different places, whether it's to their therapy sessions, back into places, back to their home, or to a friend's home. Difference is that not only that you can use this as a rideshare service, technology-wise, you can call in. And as you're calling in, we're able to get you a ride in real time and not having to wait for you to maybe 24 hours, depending on that as well. So we are definitely utilizing this process for new contracts. We're hoping to work with new partners, and the goal is to use this model as a way to be able to reach these different demographics, providing this service for as an economic stimulus for people that are caregivers who might want to say, hey, I want to drive and receive funding. They receive 80% of the ride, 100% of their tips. And also, these individuals, youth, are also paid. We use a program called Earn and Learn and Employee Milwaukee, where they actually get paid to help us in this process of train the trainer, and actually put this on by creating these musical playlists for individuals as they go. The other thing about this transportation, it brings back freedom and it brings them back their dignity. And so it allows individuals to take this individualized ride, which is not part of any other system, but an individualized car ride that gets them to places. And the goal is to then start building these businesses that they go to start building them, become dementia capable, dementia friendly. So now it's a hand to hand instead of a door to door. And then the overall goal is that everyone can use the service, even as they start to progress throughout the process of the disease from well. So the caregiver gets a break, the individual gets to be able to use this as a way of quality of life. And the goal is to be able to build this type of model to be able to utilize in other communities as well. And I think that's next slide, and we can go to, if there's any questions. That's what I got.
Thank you so much, Bashir. I'm watching you. 2 minutes left. You guys are awesome. So do we have any questions? That's so interesting. I think your program is so unique and serves such a need in the community, and I wish we could replicate it everywhere. I appreciate your work, and I appreciate all of you speakers for coming and sharing with us today. Jeremy, do we have any questions remaining?
No, our speakers have been diligent in answering the questions in the Q&A as they come up. So thank you all for that. Actually, we just got one that came right in. Are the drivers, are they paid or are they volunteers? I'm not sure who that question is directed toward.
Dr.
Well,
Easter, or go
yeah.
ahead, Alina.
I would say our drivers are paid drivers. They're not volunteers.
Our drivers are paid as well. They get paid in two ways: from funding that we get from the foundation, and then funding that we do with the LLC. They get paid in that as well, and they also get paid for training.
I will be following up after this session with an email with a link to a evaluation, as well as perhaps a recap of some of the Q&A. And you will have access to the slides. And I know there's some live links in the slides to get you some more resources and information. But I really want to thank everyone for attending today, and for the speakers in particular, and for Jeremy for helping me, and to our captioner. So I hope everyone has a wonderful rest of their day and week. So thank you for attending.
Thank you. Have a great day.